So thanks for that question. I want to pinpoint that endometriosis is a prevalent, chronic, debilitating disease, and I've been practicing gynecology for about 20 years. I've taken care of many, many patients with early and mid stages and late endometriosis. Um, I'm at a big institution that is dedicated to research. So we live and breathe the research every day. And we try to find, number one, causes of any disease, but along with finding out causes of disease, also looking at ways to diagnose it early and effectively, as well as find best treatment strategies. So that's what I do as clinical faculty at Yale. And I am partnering with the chair of OBGYN here, Dr. Hugh Taylor, who's been running research on endometriosis for decades. My part in this research is focusing on adolescent females because I firmly believe that diagnosing endometriosis when woman is 30 or 40s and trying to get pregnant, that is way too late. So we need to shift diagnosis to early diagnosis and focusing on adolescents who are suffering from this disease. Our study is what we consider a gold standard because this is a prospective trial, and we selected patients who had laparoscopy, and that's a surgical way to diagnose endometriosis or disprove endometriosis. So our study was tied to surgery, and all of our patients had surgery to prove or disprove diagnosis of endometriosis, which gave us an opportunity to divide them in two groups. One is who had disease, so disease group, and control, people who had surgery for various reasons but did not have endometriosis. And my populations are adolescents. Our youngest patient is age 13 years of age, and our oldest patient is 25. So it's adolescents and young adults. And majority of these patients had chronic pelvic pain. Some of them had ovarian cysts, and those patients, after surveillance, were not found to have endometriosis, which put them into control group. Search for biomarker for endometriosis has been ongoing for decades. There are over 100 various serum proteins described as potential biomarker, but none of them has taken place in clinical practice. So none of them was specific enough to be used as a clinical marker. MicroRNAs have been in the clinical research for as well decades for various diseases, including cancer, as well as endometriosis. So microRNAs are byproducts, and they're small non-coding molecules that just free float in the blood. There's just a sample there. Take them, analyze them, and they're differentially expressed in various tissues. And we know that in girls and women with endometriosis, there's a different profile of microRNAs. And so that's exactly what we sought out to research. We wanted to analyze microRNAs as a profile and compare those microRNAs to patients with endometriosis and without. So we analyzed over 800 microRNAs, but then we looked at specifically ones that were unique to adolescent population. And we realized that there are 4 microRNAs that were significantly highly elevated in patients with endometriosis. And there were 18 unique microRNAs that were significantly decreased in patients with endometriosis. So this gives us a pathway or signature microRNA profile that potentially can be used as a biomarker, as a non-invasive biomarker for diagnosis of the disease. We're super excited about these findings. We're hoping to move to clinical phase trials. And needless to say that even laparoscopy is a major surgery. It requires general anesthesia with possible side effects and some risks involved. In laparoscopy, we take every surgery seriously. So an adolescent patient and her parents, for most parts, want to avoid surgery. So if we as physicians, as a medical community, can offer a non-invasive test to with certain precision diagnose endometriosis, they'll be great. And I also want to emphasize that this will be just an adjunct to our same pathway, our clinical history taking, family history taking, physical examination, ultrasonographic findings, and then we'll have a test, a blood test to offer, which is easily done in the clinic setting. Thanks for that question. I will say I'm passionate about this condition. I am compassionate with my patients and families. I usually take care of not just one patient, but a family. So it's a adolescent patient and one or both of her parents. And it's a journey. And I unfortunately have seen too many patients who have seen two or three providers out in the community, and diagnosis of endometriosis has not been entertained. And that's a gap, that's a problem. And I say we have to start educating our medical students, our residents, our fellows, pediatricians in the community, because it is not okay to have just painful periods. I've seen it, I've heard it. Pediatricians will say, oh, you have painful periods, take Motrin, go along your way. That's not okay. And I also will say that menstrual pain or cramps is the only pain that we kind of normalized, and that is not appropriate. We need to listen to our patients. I tell my residents and students, if all fails, go back and talk to your patients. If you don't know the diagnosis, go back, talk to your patients. They will tell you, they will guide you, and trust your patient, trust your instincts as well.